Hey guys, Dr. Chris Park here, and today I want to talk to you about something I've had a few questions about recently, and it's the new medication Sublocade. So, Sublocade is a new monthly buprenorphine injection for people who struggle with opiate use disorder, opiate addiction, opiate dependence. Um, like I said, it's a subcutaneous injection given monthly. You get 300 milligram dose the first month, 300 milligram dose the second month, and then it's 100 milligrams every month after that. Except in a few cases, some people might need 300 milligrams every month, but I'm not sure how that's actually going to play out in the real world. I don't actually have any patients on this medication yet. I've got several asking me about it, and so I've been researching it, and so I thought I'd share this with you. So, like we said, it's for opiate use disorder, and it's for people who have already stabilized on a buprenorphine dose. So in other words, you're not buprenorphine naive. Now, the company says stable on buprenorphine for 7 days. I think you probably need longer than that, but that's just me guessing, okay, based on my experience. But anyway, so a monthly shot has its benefits, right? Just off the top of my head, I mean, it ensures compliance. You're getting the shot in the office, so I don't have to worry if you're taking your medicines correctly. And you yourself, maybe you don't feel like you can trust yourself, especially if you're new to treatment. You know, you're used to just kind of popping pills, or maybe you're old to treatment and you're used to taking more at the beginning of the month, less at the end of the month, and it's just not a great way to stay clean. And so a monthly shot could help with that tremendously, right? The other thing is maybe the environment you're at is not safe. Other people are going to be in and out of your house. Maybe you have a history of people stealing your medicine, so this might be a good option for you. Maybe this is a good option for people, coming out of a prison situation, other things where there's just some intense monitoring going on and you just need that verification of treatment. I've got patients too who just don't like having to have any medicine at work, or they work weird kind of shift hours, and so some days they may work 8, some 12, and they don't want to have to worry about when they're going to take their dose or whatever. So this makes that easier, right, for them. But I tell you, but it's not for someone who's tapering off their medicine, because there's no way to taper, and whether this is, I don't know if this is the fault of the company or if this was intentional, or, some people are in the mindset that people with opiate use disorder just need to stay on a maintained dose. And so maybe this is more for people who think they need a continuous dose for a long period of time. Now, just because you're on this doesn't mean you can't taper off. You just can't taper off with this medication. So in other words, you would have to then change over to something like Suboxone or Subutex and wean off. So that to me is a big negative, but it's not a deal breaker. Now, some of the side effects of this medication are similar to the other side effects of Suboxone, Subutex, Bunovel, Zubsolv, and that's constipation, possible headaches, possible nausea. But one side effect that is not like these others deals with the fact that it's an injection, and that's what they call a site reaction, which can happen where you give the injection on your abdomen, and you can get these like red, hard, uncomfortable areas, and so that's just something to be aware of. It doesn't mean it's going to happen to you, okay? And obviously, and they'll go away, and you can always stop the medication if this is a big problem. I don't think there was a high discontinuation rate in the studies, but I'm not 100% sure of that, and you can't go by that because in these drug studies, a lot of times people are being paid to stay in the study, right? So, it takes some of that. Anyway, you've got some other factors in why people might stay through a study, whereas in the real world, someone might say, no, I don't want to continue that medication. But I don't know how applicable that's going to be in the real world yet, because like I said, I don't have any patients on it, so I don't know how these site reactions are going to affect people. So we shall see. Other things you need to be aware of, and this kind of goes with all buprenorphine, though. You don't need to be mixing with benzos, such as Ativan, Xanax, Valium, or Ativan, or alcohol. Now, there may be some rare exceptions to this rule, but in general, I think that's a safe rule to follow. Also, if you have any severe allergic reaction, or you feel faint, dizzy, have trouble walking after taking, obviously you need to notify a doctor immediately and be evaluated. What else? Oh yes, problems with the liver. That's something that needs to be monitored as well. Now, if you have liver disease, it doesn't mean you can't use this medicine. I mean, I have patients with hepatitis that we treat all the time with Suboxone or Subutex. Their liver specialists never take them off this medicine, typically because it is safer for their liver than what they were doing previously, right? So, but just make sure your doctor knows your full medical history. Make sure your doctor knows the medicines you're on. And if you're going to a doctor who doesn't care about those things, you need to find a new doctor. All right, guys, that is a little video on Sublocade. If you have any other specific questions, feel free to ask. And maybe I'll shoot another video or update or put something in the comments. Also, if you're looking for some more information to read on anything, I have a website, drchrispark.com, where I don't always talk just straight addiction. I have some other things too, maybe some stories of inspiration, or maybe some random stories about my tattoos. You never know what you're going to get. So, all right, guys, I hope y'all have a great week.